Vaccine hesitancy remains a big issue for countries around the globe. Family physician Dr. Orville Nemard says among the concerns is how quickly the vaccines were developed. But Dr. Nemard explains that coronaviruses have been around for a long time. For example, the common cold, SARS, and MERS. As a result, research has long been underway.
In 2020, when the genetic sequencing of the SARS-CoV-2 was made public, persons simply took that information and plugged it into research which was already going on for 20 years. So it's not as if that in a year, persons came up with this fabulous solution. There was already 20 years or more of experience behind this, which pushed forward for the development of a vaccine in short order.
Dr. Nemard says the other issue raised is that the technology for vaccine production has changed. Some persons are of the view that the technology used will alter one's DNA or reprogram them. But he's assuring Jamaicans this is false.
So currently, particularly with the Pfizer and the Moderna vaccines, they're using mRNA technology. Now, because the delivery system is different from what we're used to, it's the first time that system is being used, clearly there's suspicion, there's always apprehension. But the data says that the mRNA does not enter the nucleus of the cell. It does not in any way alter the genetic material of the cell. What it does is it simply delivers the message, and with that, it is gone.
The family physician says similar technology was used for AstraZeneca and Johnson & Johnson vaccines, all new but still effective. Dr. Nemard says while he understands the concerns based on the data and history, persons should not be worried.
The history of vaccines is a long and deep one. If we look back at our own society here, we don't see polio. We don't see measles, we don't see diphtheria, we don't see whooping cough, we don't see tetanus. And that's because of vaccines, and that's because of mandatory vaccines, which is what happens in childhood for school admission.
Persons in doubt are encouraged to talk to an expert who is credible. Taking the jab is a step towards ending the pandemic. With your health report, I'm Shamela Pullen wishing you good health.